Hi, I'm Dr. Bojack from Atlantic Chiropractic in Stoneham, Mass, your posture doctor. Today, we want to talk about our intention for you, our members, or our new patients, okay? And what we're going to talk about is why we're doing what we're doing, okay? So I'm going to use a little bit of an analogy of this, right? This is your obviously you can see this right here. This is a toothbrush. And the reason why you have a toothbrush is for what? Dental hygiene, right? To make sure you keep your teeth healthy. Okay? And remember, your teeth are nothing more than pulp and enamel, right? That's the reason why you're keeping it healthy, and you're doing it with this toothbrush. Okay? So, consequently, if you went to the dentist and he said you had a cavity, he wouldn't share with you, Mrs. Smith, you have an option. You can fill that cavity all the way, or you can fill that cavity partially. Okay? I don't even think he'd give you that option, right? It either take care of the cavity or don't take care of the cavity. So we and our team, our superstar team at Atlanta Chiropractic, have the same philosophy. When you have a subluxation, it's not whether you want to correct it partially or mildly or just a little bit or a lot. We want to make sure we correct it totally. Okay? So that's our whole premise. And the reason why we want to correct it totally is because of this guy right here, right? Function. Okay? Because we're the function doctors. Okay? Not only the posture, okay, dictates your function. And the reason why we want to take the resistance off that neurology, which is inside your spine, is for functional integrity, to make sure that neurology or that software or that communication or message or instruction or coach, and obviously in here in New England we like Belichick because he's our coach here, okay, is directing and sending and instructing those messages to your hardware at 100%. Okay, so when you come in Atlanta Chiropractic, the first thing we'll do is a consult, an examination. We'll do a specific postural check, and then we'll do some ranges of motion, and then we'll take some specific spinal x-rays for your posture, okay? And that's our recipe, okay? If you ask your mom to cook a cake or a pie, right, and you said you wanted a specific pumpkin pie or a specific banana cake, right, you would need, or she would ask you for a recipe, okay? So our recipe for your care and for your quality treatment, which is we don't do anything but the very best quality of treatment here at Atlanta Chiropractic. Okay, we need to do that actual uptake or workup in order for us to get some actual references and measurements, so we can devise a specific personalized game plan for your problems for us to make those changes. Okay, and I got a hunch in most instances, those subluxations or misalignments didn't start yesterday, nor did they start a day before, nor 3 weeks before. Okay, they've been ongoing for a period of time, and in most instances, okay, it's years. And initially it started out intermittently, they were coming and going, and then they got more and more frequent. And then they got more and more frequent with longer frequencies and more durations of times that you experienced it. The intensity or the irritation of pain increased as a consequence to that. Okay, so for us to clear out those actual patterns, those postural patterns, or those mechanical patterns that have been in there for a while, it got in there over time. It's going to come out over time. It's not going to come out with one adjustment. Okay? I'm curious, when did you go to the doctor last, and when we gave you a medication, he gave you one pill? Or maybe he gave you 2 pills, or maybe we really hit the jackpot and he gave you 3 pills. Okay? He gave you 30 He gave you 60, he gave you 90, he gave you 120 pills. Because what? You had to get it into your system for that chemistry to change for that actual medication to work. Okay? On the same premise, our adjustments aren't going to just be some supernatural activity or treatment. I'm going to adjust you once and you know what? It's going to change your life forever and you're going to totally be a different person and you're going to be able to work out 3 times a day and lose 60 pounds. It's not happening, right? It's going to take some time to clear out, just as anything else is going to take time when it's established patterns as a result. Okay? So again, I want you to understand, again, there's a reason why we're doing what we're doing. Okay? We do our workup for a reason, to see exactly what your recipe is, for us to actually devise a specific game plan for that recipe, for you, the patient, or our member, to get the results that they want in our clinic. Okay? Is it different? Yes. Is it unique? Yes. Does it take a little bit more time? It does. Okay? But again, the most important things in our life are usually the things you can't see versus the things you can see, and health is one of the most valuable things we have. Okay? And it's the actual pillar, right, of what happens and what pivots during the course of your life if you're healthy versus you're unhealthy, and the experiences that you're going to have as a consequence to that. Okay? So, again, we want your experiences to be the very best, okay? The strongest, the most powerful experiences. In order for that to occur, you're going to have to be healthy. Okay? And our shift is to get you out of a medically oriented environment into a more natural environment, okay? And from a more outside environment to an inside environment, okay? So you're working from inside out versus outside in, okay? And just that paradigm shift, or just that little shift of you moving and realizing the power that you have inside versus the power you have outside is going to be huge, okay? Because again, our immune response, our intelligence, or that neurology, okay, is so powerful for you, the individual, because there's only one intelligence that runs your body, okay, and it's your intelligence. And the only thing we're doing here is increasing the expression of that intelligence for you to respond and function at that higher level, right? We all have computers. The hardware is only as good as the software. If the softwares weren't running and expressing and connecting the way it needs to, then the hardware is going to respond. If you have bugs in that software, okay, if you have some disconnect in that software or a bug, okay, that message, instruction, or direction is not going to get to that hardware, and hence that hardware is not going to respond the way it needs to as a consequence to that. Well, our bodies are no different. Again, the pillar of how that body responds is through the neurology. Okay? It's not a pill. It's not a potion. It's not a lotion. It's neurology. And neurology is going to make the distinction of how you respond or how you don't respond. Okay? And not just a premise of physical response, but mental response, emotional response, and chemical response. Okay, those are the stresses that we have. And on top of that, we have what? Vertical gravity pushing down on us. Okay, so we have even vertical gravity for stress. Okay, and that's really distinguished as we get older, right? You see that in your grandparents, your relatives, your uncles, as they start to get older and they get less. They have less motion and mobility, and you're more sedentary. What are they doing? They're going into this rounded shoulder look, okay? Or the anterior translation. This is your biggest mass, and then it's going to irritate that low back as a consequence to that, okay? So just like our cells are either increasing in production, increasing in life, or dying, one or the other. Well, as you move toward your life, or you move through your life, you're going to increase your functional capacity, or your functional capacity is going to decrease. Okay? So as far as I'm concerned, I want to increase my functional capacity, and the more knowledgeable you are about how you function and the way you function, the better you're going to work, the better you're going to respond, and the greater longevity you're going to have in regards to that timeline as far as your functional capacity is concerned. And again, your functional capacity is going to make the difference of what you experience in life, right? If you're not functioning, you can't move around a lot, you can't travel, right? You can't go out there and do the physical things. You're going to be restricted more and more to non-moving experiences, or less mobility and motion as a result. And really, our life is motion, right? Increased motion is increased life. Decreased motion is decreased life. A rolling rock gathers no what? Moss. Okay? Kind of the same distinction, right? When our joints are moving, we're not going to get the arthritis. If our joints aren't moving and they're out of place and they're misaligned, we're going to get more arthritic stuff. Okay? You put a nut on a bolt and it doesn't move, it's going to rust. Okay? The same thing happens with our structural integrities. If there's no motion going on there, you're going to get more and more arthritic stuff. And more arthritic stuff is going to cause more irritation to that neurology and the pressure on that neurology, which is going to interrupt those instructions, directions, or messages as a consequence to that. Okay? So again, remember, our intention at Atlantic Chiropractic is for you to get healthy. Not just from a pain standpoint, but from a functional standpoint. As far as I'm concerned, if I don't get you to increase your functional capacity, okay, then I missed the boat and I didn't educate you well. Okay, I want you to make that transition, or that paradigm shift, from pain to what? Functional integrity. Okay? And that's why we're functional doctors. Okay? Again, and that's what you want. Our bodies are moving all the time. They're changing all the time. They're not static. Okay? They're not non-motion, they're motion. They don't stand still, they're always moving. They're dynamic. We're dynamic individuals and creatures. We're going to remain dynamic spiritual creatures as we move forward. Okay, and that's our essence. Hence, I want to increase your essence, to increase your function, to realize what you are and the potential that you have. And we're all stars. We all come from stars. Hence, we all have the capacity to perform like stars. So give us a chance at Atlantic Chiropractic to make you not just a star, but a superstar. And give us an opportunity to check your posture and your functional capacity to increase your neurology. We'd love to see you. Our number is 781-GET-WELL, 781-438-9355. Let us look at your posture and see if it's normal or abnormal, and get you on the road to health. Natural health. Love to see you. God bless. Have a tippy Thursday. Enjoy.